We're looking at trying to improve patient flow and streamlining patient care by providing the right clinician early in the patient's journey. We're breaking it down into ambulatory stream and the major stream so that we get senior decision makers seeing patients early in their journey.
There has been quite a lot of research and pilot program has been done in the country, including ourselves. It also reduced the number of unnecessary admissions, and it also decreased the pressure on the emergency services.
We actually process mapped the patient, and I have to say, when we wrote down the patient's journey on paper, for somebody who was working inside there and had worked inside there a long time, we knew there were improvements to make, but it was a really messy process. And what we've looked at is that process and trying to stream that so that a lot of the decision making or the diagnostics are done as the patient comes through the door, and the only waiting will be for results or effects of treatment, cutting out again a lot of that non-value time that a patient experiences in the department presently.
It's actually been a great opportunity, something that I've been able to be involved in, obviously from a lower level. I think one of the main things was, for a lot of years, we've obviously had a lot of problems in the department with flow, and the pressures have been increasing year on year. And I think this was an opportunity where we could actually get in there and make some changes, you know, on the shop floor level.
The front of house is going to affect everybody in the hospital and the community. It's going to affect them by they're going to have to be more involved in emergency care and unscheduled care. We'll be looking, as well as the emergency departments providing the bulk of the care, we'll be looking for the other specialities to be heavily involved to ensure that there are no bottlenecks and barriers to patient flow and patient care.
The most important thing is that the people who are actually part of this whole process, they are very motivated, they are very energetic, and they're very passionate about that we do implement the system as much as possible and as soon as possible.
We're doing it as a trust. This is something that has been evidenced from both departments, and we should be providing the same type of care to the same type of patients at both sites. So it doesn't matter where you turn up, you should be getting the same level of care.